One of the earlier cases we placed with Fortune Health, they were facing a large, fully insured renewal with a name brand health insurance carrier that we'd all recognize. And they were looking at like a 33% increase over current, and they were a municipality. And so, unfortunately, they didn't have the budgets. They were going to have to pass on a large increase to employees. And so we were able to move that group from that fully insured plan to a partially self-funded plan with Virtue Health. We implemented some risk management strategies. Noted in this process, benefits stayed the same deductibles, co-pays, co-insurance, same premium contributions from the employees. And we're able to get that initial renewal from a 33% down to a net 8% increase, which is good. But at the end of that first year was even better, is because of some of the cost containment things we put in place, especially around the prescription drugs, some multiple direct contracts we had for many outpatient procedures, and a couple other things. At the end of year one, that group actually had a $539,000 surplus. They were able to generate from their level, they were level funding in their plan. So not only did we get the initial renewal from a 33 down to an 8% for moving to the Virtue Health program, but at the end of year one, there was an additional $539,000 surplus for the group, again, to help offset future costs, to reinvest back into their employees and improve benefits. With some of that money, the group actually went ahead and sponsored a direct primary care clinic for all their employees. A lot of these police and firemen that work for them have young families, and being able for them to access, that primary care at $0 very conveniently for them, quick appointments. It's been honestly a game changer for them. Their employees are able to get the care that they need. The municipality is able to lower their costs, not have to worry about budgeting for major healthcare increases in the future. That was just year one. In years 2s and 3s, their surplus is picked up about a few $100,000. And so, again, this municipality, while there is no silver bullets in this industry, they have become, our number one case study and essentially have fixed healthcare for their organization.